Greetings. My name is Shaheem Scarborough, and I'm a student attending the illustrious North Carolina Central University. Today, I'm going to be delivering a speech on the benefits of quitting vapor usage as well as cigarette and marijuana use. Thank you so much, and I hope you enjoy. Now, has nicotine become a primary factor in your everyday routine? Do you use vaporizers? These questions alone serve as a dire questionnaire due to its deadly result if the participant says yes to them. Dire not just to one's health, but also the health of others around them. Today, I'm going to be discussing the benefits of subsiding vapor usage and other smoking paraphernalia. Now, as far as research has found, vaping was first created around the 15th century. Since then, vaping has become a substitution for tobacco consumption in recent years. Studies have shown that consumption of vapor usage results in harsh and toxic metals such as cadmium and lead being inserted into the body. Both of these toxic formulations can be found present in not just vaporizers, but cigarettes as well. According to the Tobacco Free CA, an organization against the use of tobacco and vapor use for teenagers and young adults, the CDPH discovered that there is a higher concentration of toxic metals in vapor liquids and aerosols than cigarettes. Children are more vulnerable to the effects of nicotine and aerosol vapor emission, as their brains are still in the developing process. In the United States, there was a recorded 10.7% of women pregnant from ages 20 to 24 that were smoking while pregnant, according to the CDC. The effects of vaporizing while pregnant are still fairly unknown, seeing as vaping is still a newer trend of smoking. However, it is a fact that nicotine consumption of any kind while pregnant is harmful to an unborn baby, resulting in birth defects in most cases. Now, while many will disagree about the probability of birth defects, however, the sad truth is that they're never detectable until the first trimester of pregnancy, in between the 11th and 13th week of pregnancy. That information was provided by the CDC as well. But according to the American Lung Association, smoking of any kind resulted in an estimated 20 to 30% of low birth weight babies, up to 14% of preterm deliveries, and about 10% of all infant deaths back in 2020. While vapor use and tobacco use is more prevalent in the discussion of infant birth defects, a less spotlighted but just as dangerous substance abuse is that of marijuana use while pregnant. While having similar effects as tobacco use, marijuana's pivotal chemical of tetrahydrocannabinol can cause low birth weight and other various birth defects during a child's development in the womb. There is still more research to be conducted pertaining to the birth effects of marijuana. However, just like vaping and nicotine use, it is highly suggested that pregnant women refrain from smoking at all costs, as it can be detrimental to the health of your unborn child. Not only should women refrain from tobacco and vapor use, but also the male partner as well. According to Science Daily, if the fathers-to-be consume any type of smoking product while consummating for a child, there can be congenital heart birth defects passed to the infant. There is a listed timeline of positive effects that can happen to the body as soon as the consumer quits smoking. This timeline is provided by the organization simply titled QUIT, which promotes the cessation or gradual disuse of smoking. Now, after the first 20 minutes, there is a normalization of heart rate as it returns back to normal. After 12 hours, there is a leveled amount of carbon monoxide in your blood. After 2 to 3 weeks, the risk of heart attack subsides and your lungs begin to function properly. After 1 to 9 months without smoking, there is a decrease in your cough and shortness of breath. After a full year of not smoking, your risk of coronary heart disease is cut down to just half that of a habitual smoker. Now, after 5 years of not smoking, you have a substantial decrease in your risk for stroke. Finally, after 10 to 15 years of not smoking, you are at an exponentially lower risk for contracting various cancers throughout the body. Overall, there are numerous health benefits that come along with the discontinuation of smoking, no matter how long you've been smoking either. According to the government organization of smokefree.gov, there is also mental benefits to quitting smoking. Mental benefits such as better vision and hearing, as well as breaking the addictive cycle that cigarettes, vapor, and marijuana use create in the brain. Although there are many factors to quitting smoking, One factor in particular creates an almost impossible to overcome obstacle. That factor is addiction. Nicotine has been revealed to be as addictive as the two hard drugs of heroin and cocaine, according to the Heart Organization. When in use, nicotine can create a feeling of euphoria due to the dopamine that is released into the brain when the recipient indulges in their addictive chemical. Sustaining from addictive chemicals creates a withdrawal effect in the brain as it experiences a sensation of dysphoria. In conclusion, ceasing the continuation of cigarette, vapor, and marijuana use can be tremendously positive to one's health in a multitude of aspects. Smoke of any kind affects primary health functions in the brain and body, such as the lungs, skin, and, like I said, the brain. Even after 1 day of quitting smoking, there is already a significant amount of health benefits that become present in the recipient. Instead of partaking in harsh and addictive chemicals, it is best to substitute the health detriment of smoking with a more positive and healthier behavior. Behaviors such as exercising, reading, and even meditating can suffice. Excuse me. Thank you so much for your time, and hopefully I've convinced you to make a change that will benefit you and your health. Thank you so much.